O ye faithful. Yeah. Can you hear it? I mean, I am a great singer. Are you ready to sing?
Yeah, let's
do it. All right. Shelby Lambdin from CHAS Community Health joining me to talk about the intersection between workforce development and public health or community health. Thank you for joining us. We just filmed at Fox, or at KHQ, that will air on Fox. How was that?
It was a fun experience.
Was it?
Yeah.
Good. All right,
yeah,
good.
Short and sweet, which I liked.
Easy?
Yeah.
Good. So we talked about CHAS's partnership at the Resource Center. A little bit of background. Resource Center opened about 3 years ago. We started as a place to provide access to housing, various social supports, and then CHAS came along as a partner to provide access to healthcare. Seems obvious, but why? Why are you joining us? We love it, don't get me wrong, but what's in it for CHAS?
Yeah, I think there was really no question about it when the Resource Center started for us to partner with you all, because our missions and goals are just so aligned, and bringing those healthcare services to the community in places where they may not otherwise have access to that. And then also having what I like to refer to the Resource Center as that really one-stop shop for all of the wraparound and social services that the community needs. And we know that there is so much more to an individual's health than the care that we can provide within our clinics. So having those different service agencies that are working under one roof to provide all of those different supports for the community's social determinant of health needs has been a great partnership for us.
I love you now. That was wonderful. That was so well said. We feel the same way on the workforce side. We know in order to have strong businesses, you have to have strong workers. And in order to have strong workers, we need to have a healthy workforce. And you can't have that without access to healthcare.
Yeah,
so thank you.
Absolutely.
And oh my gosh, it's so amazing that you also provide access through your staff to various languages and communities.
Yeah.
That has been critical. Can you tell us about that? And did you specifically select those staff to join us, or how'd that happen? Because they're so good.
Yeah, absolutely. Well, it actually really just started out of a necessity for a space for these wonderful community health workers that we had at CHAS to be able to go and work and provide the services that they can provide. But it's really evolved beyond that, and we found that there was such a critical need for that language access to the community in a space that they're already comfortable going to, but there may not be language access. So we have community health workers who speak Marshallese, Russian, Pashto, and Dari on site. And they're not only working with our CHAS patients who are coming through, but they're also working with any of the other clients who are working with the other service partners as well.
Do you want to give a shout out to those staff? You want to?
Yeah.
I don't want to maybe say names incorrectly, and
No,
I adore them, so please.
Yeah, no, our community health workers who are on site at the Resource Center, they love going there every day. They love working with the staff and getting to be a part of not only a CHAS team, but a team with like-minded community partners who are really sharing similar goals and missions in the work that they're doing for the community. So we have Olga, Jimmy, Abad, and Betlin, who are all on site at the Resource Center every week.
Round of applause to each of them. They're so good.
Yeah, they're awesome. They're awesome.
You guys do a great job hiring. Oh my gosh. You must be a great employer to work for.
Yeah.
You've retained the employees that I have known. We have one of your staff, I'm not sure of Kelly's title now.
Chief Administrative Officer.
Okay, yeah. On our board. So fantastic.
Yeah.
You've just been such good partners. So great job. It's seemingly to be a great employer and a great partner.
Yeah, absolutely. We have great benefits and really care about our staff. And the cool thing about CHAS is that everyone who works there really believes and lives out our mission day to day. It's not just something that we have written on a wall. It's something that everyone who we hire is bringing that into their role. And the other thing, too, that I really like to say about CHAS Health as an employer is, yes, we're providing a great service to the community through affordable and quality healthcare, but we also are becoming an increasingly large employer for the community as well. So we have apprenticeship programs, we have student clerk programs, so that if a student is interested in healthcare but not quite sure which direction they want to take, they can go and work in a clinic after school and get a sense of what that looks like.
So I will, I feel like I could just plug CHAS all day long.
Please do.
We've partnered with you specifically through the Next Generation Zone to introduce our younger workforce into these apprenticeship programs. And what I want to say is it's actually accessible. It's not one of those programs where you hear about it and feel like, or should feel like, that's not actually for me, because the care that you all have shown to bring someone in and really introduce them to the healthcare community is fantastic.
Yeah.
Good job.
Yeah, absolutely. Thank you.
So you have a mobile health clinic and a flu vaccine. So before we wrap up, tell us about that. The mobile clinic, so on-site healthcare, that's incredible.
Yeah, so one of our core values is entrepreneurship at CHAS. So one thing we're continuously doing is looking for new ways to serve the community and reduce those barriers to care. During COVID, we realized that patients just weren't getting in. They have barriers to receiving health care, whether that's transportation, work, childcare issues. So we are now launching a mobile medicine program that will be bringing healthcare services to the community where they're at to reduce some of those barriers.
That's so fantastic. Yeah. I just want to say thank you to the community. Before I ask you your final question, thank you to the community for supporting the Resource Center. Thank you to Spokane County. You've been one of our biggest supporters. We want to give you a shout out for allowing us a place, access to a place that we can provide connections to healthcare and workforce development, housing, and now childcare. It's absolutely incredible. So, Shelby, I ask all of the guests here who usually are from the workforce development system, what is the nerdiest thing that you've done? Because we call ourselves workforce nerds around here. It's a workforce nerd podcast. What's the nerdiest thing you've done in workforce development? So for you, because you come from community health, I will say, what is the nerdiest thing you've done in community health, and relate it to workforce development if you want. But I feel like you're a nerd with us. Yeah. So
yeah,
absolutely.
Tell us
about it.
No, I'm definitely a nerd, and I think one of the cool things about my role and our team at CHAS is that we really have a team that reflects not only the needs of the community, but the community itself. So I think where the intersection between community health and my team at CHAS and workforce comes into play is that I get to sit down and actually learn from the community what their needs are, and then we're able to build a workforce that represents that within our health equity team at CHAS, which I nerd out on a lot because I love doing like focus groups and surveys and studies to better understand what the needs of the community are.
Pretty nerdy if you love doing focus groups
and
studies.
I know.
I'll give you that. All right. You're an honorable honorary workforce nerd.
All right. I'll take that.
All right. Thank you. Thanks for joining us. It's been a lot of fun. And thanks for being at the Resource Center.
Yeah. Thanks for having me.
And you're going to sing us out, right?
Yeah.